Good morning. Good morning. Okay, you are welcome to our lectures for today. We are still on the course Basic Dispensing Theory, BDT 152, and the topic is still powder and granules. Powder and granules. Here at the School of Pharmacy Technicians, University on the Niger Teaching Hospital, Iyenu, Anambra State, Nigeria. In our last, that was yesterday, we discussed preparation of powders. The preparation of divided powders and undivided powders. And we did a lot of powder calculations. You know, I told you that the first thing, after ensuring that what you have, that the ingredients in the formula, that they are available, and they are in good shape, and are in the required quantity needed are there. The next thing is to do your work, calculations. After that, then you now start your size reduction, sifting, weighing, mixing, if the formulation requires excipients and other things involved, till down to the what packaging and the storage and as the case may be, or dispensing to the patient in question. You know, this is extemporaneous what compounding. Okay, so today I want to say one or two things on the advantages and disadvantages of powder as a dosage form. So let's look at the advantages of powder. Are we together? Yes. Okay. Advantages of powder. You know, powder, they are solid. Powder is a solid dosage form. So powder has what? Good chemical what? Stability when compared with what? Liquid what? Dosage form. Are we together? It has a better chemical what? Stability. You can put down. So powder has what? A better what? Stability when compared with what? Liquid what? Dosage form. And number two is that powder is very, very useful for bulky drugs. That is drugs with large what? Doses. We know them now. Example is our indigestion powder, antacid, and what have you, right? Good. That is for internally used one. Hope you know. Yes. Then for the externally used one, we talk of the what? Dusting powder and what have you. Are we together? Yes, sir. So number three is that when a drug is formulated as powder, it's easier to swallow even in bulk or even in large bulk, especially when you mix it with food. This is when mixed in liquid form anyway. Have you heard of okay, I don't think I've mentioned it in this class. Have you heard of what is it called? Have you heard of total parenteral nutrition.
Yeah, yes.
Have you heard about it?
Yes.
Okay. And also, when it comes, even though that one goes straight to the what? Intravenous anyway. But there is one that you have you heard of nasogastric tube? Let me not take it far, but just know that it's easier to do what? Swallow. You can swallow it in bulk what? In large bulk, especially when you dissolve or disperse in what liquid. Are we together? Good. Then, because of the large surface area, you know that the powder particles, they are small, right? They are small particles. Are we together? Yes. So the small particle size of this powder leads to more rapid dissolution in the body fluid. Lead to more rapid dissolution. That means powder dosage form, they have the higher rate of dissolution. You know, when you take tablet will enter the system, disintegrates. This takes time. Are we together? But once you mix the powder, disperse or dissolve and take it, what will happen? Immediately it gets to the GIT. Dissolution is not an issue again. True of us. Next thing is absorption, right?
Yes, sir.
Right? Good. So, what is the implication of this? This means that it will increase the drug bioavailability. Have you heard of the term bioavailability before? Don't worry. Bioavailability. You know, when you take a medicine like tablet or even powder, on getting to the GIT, what will happen? If it is tablet, it will disintegrate now. Dissolution will take place. Then the active ingredient will now enter the bloodstream, right? By absorption, right? On getting there, that amount of that active ingredient that enters the bloodstream, when compared with amount that you actually the patient that was actually administered, it gives you the availability of the drug. Something like drug in injection form. That one doesn't need anything that has to do with absorption, disintegration. It's going straight to the bloodstream. A drug like that or a medicine like that drug will have 100% bioavailability because it is the amount that you put that was administered that will appear in the bloodstream. So if you compare the amount that appeared in the bloodstream to the amount that it will be something. So it has 100% bioavailability. I think you will still do that in your pharmacology. Don't worry, you will still do that in your AUM. I think that is this semester. Okay, don't worry. That should be one of the first things you will do. Now, this is what bioavailability is all about. So now, because the powder doesn't need all those long steps of breaking down, and once it enters the system, the absorption is faster compared with the time it enters the system and the time it appears in the bloodstream is faster. So because of that, there will be an increase in availability. Am I completing? Yes. That's the implication. And also another advantage is that because of this small particle size, there will be decrease in gastric irritation. There will be decrease in gastric. You know what irritation is? This contact between the tablet or the medicine with the mucosa of the GIT, the mucous membrane of the GIT. Sometimes the mucous membrane may be irritated, but because of the fine nature of this powder, there's a decrease in gastric irritation. Am I communicating? Yeah. So that's the advantage. The smaller particle size of this powder impact on the powder to compare with tablets. Are we together? I remember remember, you either dissolve it or disperse it and what? Drink, right? So the irritation will be minimal to compare with tablets that will still be gallivanting there in the stomach mucosa until it got broken down. So that irritation sometimes, we have the way our system reacts is differ from one another, right?
Yeah.
So if to some patients it may irritate them. In fact, some drugs on their own will irritate the GIT. True of us? Good. Now, so these things okay, let's continue. Because of this smaller particle, the smaller particle size of these powders, it also, of course, now when the particle size is smaller, the surface area will be much larger. Good. Surface area will be what? Larger. So that's what led to all these things at disadvantages that I listed, like increase in bioavailability, increase in dissolution rates, increase in bioavailability, and what have you. Any question? Any question? So I should fire up. Okay. Another advantage is that for children, for pediatric patients and geriatric patients, you know who are the pediatric and what? Geriatric, right? Yes. Children and the elderly. For this category of patients, this one is better for them. Am I competing? And also for patients that have swallowing what? Problem. Am I competing? For children, very tender, that cannot find it to swallow. And for the elderly, at the same time, for patients that, because of their nature of their sickness, they find it difficult to do what? Swallow. Such patients, powder, a drug, a medicine in powder form is good for them. For oral use. Just dissolve what is passed and do what? And go their way. In fact, there are even people that there are even some individuals that are okay. Under normal circumstances, swallowing is a problem for them. Have you seen people that even if they want to eat fufu or garlic, if you see the tiny guy, they will move. Just tiny thing. They can't swallow. But there are people that can swallow one big listener and they can go their way. So people differ. So there are some people that don't like anything swallowed. They must chew it before they do what? And they cannot chew drug. This tablet or capsule. So such patient in powder form is better for them. They can just reconstitute it, add water or any other vehicle, honey, anything that will make that for those that don't even like to take medicine, they will add things that will make it to be sweet. But as you are adding, be careful. So we'll go and add orange juice and use orange juice. Very, very funny stuff. These things react. There are some components that may react with the active ingredients. True of us. And may not render it ineffective. So water is the best. Take it or leave it. Alright, so now let's look at the disadvantages. What are the disadvantages of powder as a dosage? Okay, thank you for that. Good. It's not suitable. It's not suitable for drugs that are unstable in atmospheric condition. Do you know why?
No.
The reason is, the higher. Remember in your chemistry, when you talk about the rates of chemical reaction, what are you doing? You can't run away from there. Pharmacy is an applied what? Science. It's an applied science, chemistry, physics, biology involved. You can't shy away from these subjects. You will keep mentioning them because it's application of all these things in human life. Take it or leave it. So I will keep referring back to your history. So if you know you have issues, better go back and help yourself on time. Now, when you study the rates of chemical reaction, those that actually did chemistry, rates of chemical reaction, you know, factor that surface area is one of them, right? Can you remember? Surface area. So if the higher the surface area of the powder, what do you think will happen? It can react easily when exposed to the what? Atmospheric what? Conditions. So especially when the drug, there are some drugs that are highly unstable in atmospheric conditions. You don't formulate them as what? Powder. If you do so, they will degrade. True of us. The best thing, maybe you formulate them as tablets or capsule, enclosed. True of us. Compressed in tablet or enclosed in capsule shell to retain their work integrity. But if you leave them as powder, they may degrade. True of us. So it's not suitable for such drugs. It is also not suitable for drugs that has beta test. True of us?
Yes.
Beta test. How will you mask the entire powder? The beta test will always do what? Come on. True of us? Now, nauseating. You know what we mean by a drug is nauseating. What is nausea? Nauseating. What is nausea? Nausea is what?
Yes.
What is nausea? Oh yeah, check it up. Look it up now. Fast. I won't tell you. Look it up now. I told you to always have data in my class. Look it up. What is nausea? This is how you learn, no?
Yes.
Look it up now. What is nausea? Let's check it up. I won't tell you. I am fast. Nausea is what? So, to do what? About to. Feeling urge to do what? Vomit. There are some drugs that once they get close to you, feel like what? So they are called nauseating what? Drugs. So that's the meaning. Now, so it's not good for such what? Drugs. And also it's also not suitable for what? Deliquescent what? You did your hygroscopic substances, right? Is that right? Deliquescent absorb moisture and do what? And do what? Hygroscopic absorb moisture and do what? Sticky, right? Become sticky, right?
Yes.
Deliquescent does what? Dissolve, right? From what? They've forgotten. Alright, so now let's continue. So it's not good for such drug, and it's also not good for corrosive what? Drug. Corrosive drug. Now there is inaccuracy of what? Dose. This is the reason why. If dose of a drug is very important, you do not formulate it as what? Bulk what? Especially bulk what?
Powder.
Especially bulk what? Powder. Especially bulk powder. Anyway, the very powder, anyway, we'll try to some extent. We'll try because you have already done the calculation and know the exact amount in each wrap or sachet. But for bulk, so on a general note, there's inaccuracy of what? Goes. In the case of what? Bulk powder. Not all the powder, remember. In the case of what? Bulk powder. That informed decision that you do not formulate a drug whose dose is of utmost importance as a what? Bulk powder. The last but not the least we look at is that it's inconvenient to do what? Carry. Transportation, because it's bulk, right? Transportation becomes an issue, so it's inconvenient to do what? Carry. Yesterday we discussed the shelf life, the packaging, right? And the type of container for all the powders, right? So we are not going there again. Now let's conclude powder with the uses. Let's conclude powder with the uses of powder. So let's look at the uses of powder. Let's look at the uses of powder. Use of powder. let's look at the pharmaceutical slash clinical uses, okay?
Yes.
Pharmaceutical slash clinical uses. Pharmaceutical slash clinical uses. Pharmaceutical slash clinical what? Uses. Powders can be used as counter irritants. Counter irritants. You know what counter means? What? Opposite, right? Irritant means what? It has ability to do what? Irritate, right? So counter irritants. Example of such is found in camphor starch what? Dusting powder. Camphor starch what? Dusting powder. Then rhubarb powder is used for what?
Juvenile and
rhubarb powder. What are you saying?
okay, diapers. I don't know the pronunciation.
Dyspepsia. What is dyspepsia? You've read this, so tell me what is this by now? I told you that don't come across anywhere in your material without looking for the meaning. So now tell me, you've read this thing. What is dyspepsia? Oh yeah. What is dyspepsia? You are still making the same mistake. How can you read the material without knowing it? What is dyspepsia? What is it? Tell me. What is dyspepsia?
Dyspepsia or indigestion is a feeling of burning, pain, or discomfort and digestive tract.
Indigestion, okay? So let's continue. So rhubarb powder is used in what? Treatment of what? Dyspepsia. Some powders may be formulated as what? Antimicrobial. You read your microbiology, right?
Yes.
Some powders may be formulated as what? Antimicrobial. Example of such is powder containing what? Chlorhexidine. So the active ingredient there is what? Chlorhexidine. 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 That's the active ingredient in there is what? Anti-what? Microbial. Rhubarb is what? Is what? Dyspepsia, right?
Yes.
Rhubarb powder. Now, there are also powders that were formulated as antipyretic. What is antipyretic? Antipyretic is what? Antipyretic. What is it? So people have not learned this night talk to you. What is going on? It's not a good thing, no. Whenever your lecturer says something, go back and put it into practice. That's how to learn, and that's how to grow. There's no secret for growth. There's no secret. This is the only secret. Do it as in a horse. Take it seriously, and you see yourself progressing. I said this twice, how many times? Yet this material you have it for like how many weeks now? You see, is it that you have not gone through it, or is it that you read it, you did not do what I asked to do? Which one? What is the issue now? So what is antipyretic? Oh yeah, look it up. Fever, right? So any drug that is used to do what? Reduce fever, right? To take care of fever is an antipyretic. Example is what? Commonest one is what? Paracetamol, right? Even though it's also, okay, let me not go there. This is not from pharmacological class. Let me not go there. So, there are some powders formulated for antipyretic. Those the product, example of them contains this active ingredient, ipecacuanha and opium. Ipecacuanha and what? Opium. IPE, is there right?
Yes.
CACUAN, ipecacuanha and what?
Opium.
Opium. This combination, there's a name given to it. What's name? What's name? Is it Dove or Dovas? Huh?
Dovas powder.
Dovas what?
Powder.
It's a combination of what? It has two active ingredients. Yeah. Which are the following are components of Dovas powder? Dovas powder. What? Opium. So they are used as what? Anti-what? Paralytic. Now, another use is that magnesium, the one we did yesterday, magnesium triwhat silicate powder is used as what? Good. So we are familiar with this, right?
Yes, sir.
Good. Now powders are also used as what? Antiseptics. Oh yeah, I don't know say these are here. Get the antiseptic powder. Oh yeah. Hey. Get on Victoria. Stop looking. We are talking to you. Oh yeah, tell us. Examples of antiseptic powder you have used. Oh yeah. She's lying. Oloma, tell us now. Ozian, tell us. What antiseptic powders you used? Oh yeah. Hey. Who knows? Who knows? Look it up. So powder can be used as what? If you watch, I'm trying to limit myself to what? Dispensing, you know? I try, I don't want to go into pharmacology clinicals. So now, powders I can use as what? Antiseptics. Okay. Now, the powder, example of powder we prepared yesterday on the board, ibuprofen, right? Yes. Ibuprofen is used for what? Powder is used for what? Juvenile arthritis. I think we mentioned yesterday. Yes. We also looked up the meaning of juvenile arthritis. So ibuprofen powder is also used to treat what? Juvenile arthritis. Now, remember what I've been calling these are the pharmaceutical / clinical what? Uses. Pharmaceutical / clinical what? Uses. Now, the next one is prickly heat. You heard of prickly heat powder, right? Prickly heat, right? Who say yes? Prickly heat. Okay. What you see what happened is this prickly. So you not see any powder written something like this. What did I say? It's here. It's all over the pharmacy. Remember what I told you? Hello. You know, there's no way we can get all this dosage from here. I told you something. I said, try as much as possible. Any dosage form you study or discuss here, try as much as possible to go to a nearby pharmacy. Just try. Go to a nearby pharmacy. Try to just establish a relationship with them. Just try and look up. Try to see these things yourself. Okay? It's very important. You can Google it and see the picture, but still, if you can't, try to see it. It will help you a lot. So prickly heat powders that are used to do what? Relieve skin what? Skin burn. Of course now you know our baby powder now. Yes. Used for what? For nappy rashes, right? Yes. Nappy rashes, right? Skin and nappy what? Rashes. Skin and nappy what? Rashes. Now, these are the pharmaceutical clinical what? uses. Now let's look at, powder can also be used in confectionaries, okay? Something like baking powder, right? Yes. Baking powder, right? Yes. Good. Rumford powder is used as what? Baking powder. It is aluminium what? Free. It is aluminium what? Free. Even in cosmetics, you also use powder in what? Cosmetics. As you are what?
Face powder.
Face powder. You are Medicaid. Three of us. Do you still have heaters? Medicaid?
Yes.
Yeah. All right. This is the end of powder. For real. I want to write something. I want to write us something. An assignment. Do not submit. Try as much as possible to study the assignment. Make sure you compare it with what we have done. Make sure you know it. Don't play. Do not do what?
Play.
Because if you play, you're going to learn. All right, look at this. Put this down, okay?
Okay.
What is this?
Recipe or take
Take
down.
that, okay?
Yes.
Okay. Number 1. Calcium gluconate. 1 gram. Make powder. Sand it. Such for. Number 2. Take down paracetamol 500 milligrams. 500 milligrams. Make powder. Sand such things. Let me advise you. Are we together? So you know the different steps we took in what? Let me guide you. Just look up. You know the different steps we took in powder preparation. At least I'm sure we did up to 3 powders, right? 3 of us. We did 2 divided, right?
Yeah. Yes.
And 2 one undivided.
Yes.
Okay. Now, follow the steps. Do it in your note. Follow the steps from the beginning. Prepare. Do it as if you are actually doing this as practical. Okay? Take that steps. This one, this is number 1. The first one. This is the formula. Calcium gluconate 1 gram. Make powder. Send such for. With this now, what does it imply? What I preparing? What type of powder is this? Divided, right? Yes. For internal or external use? Internal, right? Yes. This one, for divided, right? Yes. For what? All right. You write detailed, as in write it well, as in different steps from the ensure that you have everything, all the, the what is it called, the ingredient available there. You come down to your calculation, come down to your what? Size reduction, sifting, okay? Then you are what? Weighing. Of course, when you now do your calculation, now that's when you now write what you're going to weigh. True of us. Remember your average, remember that one, okay? Then when you are done, you go down to the weighing, then you are going to tell me whether it needs to be mixed. You are going to say whether it actually, whether it needs mixing. Am I complicating?
Yes, sir.
Whether it needs mixing, whether it needs diluent, I will tell you that. I've given you the condition where you need what? The diluent. And when you don't need what? The diluent. And I've also given you the condition where you need to dilute. True of us, in terms of calculation, right? I've told you all these things. With respect to the minimum weight, and also the minimum that can be in a wrap as a wrap powder. So you do all this. When you are done, also go into the packaging. What type of container can be used to package them? Then they go down to the what is it called? The labeling direction for use. Yes, storage condition. Research and do that. Makamborg is it. Now we go over to the next topic. Granules. We are done with powder. Let's look at granules. Take this thing seriously, because one day I may just enter your class and tell you to give it to me. Let me see it. So whether I'll collect it or not, I won't tell you now. The day it will happen, I'll just appear boom. Only those that submitted it, I'll mark. That is if I decide to do so. But most important is that you should do it and do it well. I've given you the directives you need, except those that we are playing and those that refuse to come to class. Then they are going to learn in a very, very hard way. Now let's look at granules. Granules. Under this topic, we look at granules. We look at granules. Definition of granules. Are we together?
Yes, sir.
What granules is all about. So just do a brief introduction. Stephanie. Okay, don't worry, I have my phone, don't worry. Go. Feel free. Okay, so let's look at so we look at it. We have a brief introduction under which we define granules. A brief introduction under which we define granules. Then we look at the classification. We look at the classification, we look at what? Preparation, okay? We look at preparation, then we look at what? Advantages and what?
Disadvantages.
And disadvantages. We look at what? Shelf life and what? Storage. Good. Shelf life and what?
Storage.
We look at what? Containers, okay? Containers and packaging, okay?
Yes, sir.
Containers and what?
Packaging.
And packaging. Then we look at what? Huh? God bless you. Labeling. All this is should be here, okay?
Yes, sir.
They should be here. But let me just put it here. Labeling, okay? Is it double L or single L? Labeling. Is it double L or single L? Single L. Double L. Which one do I take?
Single L.
So labeling. Next thing is what? Before then, we talk about shelf
Life and service.
Shelf life and what? Last one is what? What? Pharmaceutical
Uses.
clinical what? Uses. What else? Is that all? So we look at these things under what? Granules. We have left two C's. We are saying powder. We have left two C's. We are in granules now. Now let's look at granules. Introduction. You know, listen carefully. You know powder. You know powder because powder has a very the surface area is much. Are we together? And also some of them are that what is called so some of them are fluffy, as in they are puffy. So some of them, especially those who majority of them, especially those in the amorphous form. Have you ever tried to get your powder, dusting powder, and dissolve it, put it in water? Yes. Have you tried to get your dusting powder or any powder, very powerful powder, baking powder, and put it in water? What will happen? It won't dissolve. It won't even be wet. Wetting will become an issue. True of us. You just see the powder gallivanting on the powder particle on the surface of the water. So wetting becomes an issue. Now, another instance is that if you get powder and have you ever try getting a powder and try to compress it and open your hand? Will it compress? It will scatter again. True of us. And tablets needs to be in compact form. You need to compress it. So these are one of the issues. 1, 2, 3, 4 reasons why we say no. There's need for us to formulate powder to become what? Granule form, so that if you compress it, they can be together. Am I completing?
Yes, sir.
Now, but if you get a granule, get Gary. Is Gary a powder or granule?
Granules.
Get your Gary and put in water. What will happen? It will soak. Because you can wet it easily. It can be easily what? Wetted. Get Gary powder. Sorry, Gary granules. Gary granules is it's funny, but I'm passing a very important message. Just listen carefully. Gary granules now is from where? Where is it from? Cassava what? Cassava what? It's for the, you know, those that know how to process Gary from cassava, that is nothing but granulation. It's granulation process. You will do it at home. That you know what you are doing. In here we call it what? Granulation. The powder has been granulated to what? To what? In that form. Are we together? Yes. Now this is the way of what? Introduction. Now what is granules? Granules are what? Powder. Start from there. They are actually powder. Granules are powder agglomerated. Granules are powder agglomerated To form what? To form large, free-flowing particles. To the process of what? Granulation. Simple. Granules are powder agglomerated to produce what? Large, free-flowing particles. To the process of what? Granulation. Granulation. So if you granulate powder, you produce what? You produce what? Granules. So powder, we undergo granulation and produce what? Granules. This process is what? Granulation. So when you granulate powder, you produce what? Granules. So, unlike powder that has small particles, and these granules, the size range from 4 to 10 what? Mesh. Are we together?
Yes.
And they are irregularly shaped. They are normally, or normal, they are what? Granules irregularly what shaped. But you can actually produce granules of your what? Of the shape of their choice. To the process of what? Granulation. Here now you are going to use screen or sieve as case may be. Whatever the shape of the pot through which they will pass will impact that shape in the granules you do what? Produce. That's why you can actually produce granule of your choice, the shape you want, okay? So they are irregularly shaped, but they may be prepared to be what? Spherical. You can do that if you want to. Now, another point I want to make is this: doing tableting. After this topic, we go over to what? Tablet. Doing tableting. Granules as a dosage form can act as the form, final dosage form in which for a particular drug. Am I completing? Now, it can also serve as an intermediate for tablet what? Production. Am I completing? I made mention here at the beginning of this class that tablets, to produce tablet is in compact form. You need to compress it to produce what? Tablet. So if you get powder like that and compress, it may not form tablet. Even though there are some powder that have inherent compressibility or property. The parts that have inherently, if you compress them, they can stay. There are powders like that, okay? But apart from that, on the general note, if you compress powder, the powder will not do what? Compress. It will not do what? Compress. Now, how do we take care of this? This is why they produce. This is where granules can serve as an intermediate in tablet what? Production. Because before in the process of tablet production, there's a stage we call what? Granulation. We'll still get there. So you granulate the powder to be in granule form. One is that it will help the powder it will help it to flow well and bring it to tableting. Let me not talk too much there. We'll still do that. But just know that granules serve as what? Intermediate for tablets and capsule what? Production. Have you ever seen? There are some capsules you will see if you open it. The what is inside what? Powder, fine powder. So if you see it, it not be fine powder.
Yes.
Have you seen things like that?
Yes.
Good. Yes. So granules are used as intermediates in the preparation of what? Capsule and tablet, because they flow smoothly and they predictably than small particle size of what? Powder. So now that classification, but why do we prepare granules? Why granules? when we have powder. So, reasons. We are going to the reasons. Reasons for what? Preparation of what? Granules. Reasons for the preparation of what? Granules. So why granules? Since we have powder, why do we stress ourselves? Granulating. That's the question here. Since we have powder, why are we stressing ourselves? Granulating. These are the reasons. Number one is to avoid powder segregation. Remember what I told you about together? You try to bring it together. To do what? Two of us. They do what? So to avoid such. But granules are more, they are more together, okay? They are more together than what? Powder is that is simio, that is idea is open. But granules is more what? More coherent, okay? Coherent mass. Granules can form a better coherent mass. Powder is more adherent. It will be busy adhering to the walls of whatever you do, but granules are more what? Together. So to avoid what? Powder segregation. So that's why one of the reasons why you formulate what? Granules. The second one is to enhance flow. Remember I said something about when I was describing tablets formulation. I stopped on the way. I said that when we go into tablet, I will throw more light on that. Okay, let me not even use tablet. If you get powder, if you get granules now, let's assume you get a iron zinc or metallic stuff that make it in form of a hose. Maybe something like this. Maybe you get something like this. Maybe something like this, okay? Be it plastic or whatever. And keep a container here. Food like this. And if you pour powder here, powder will not flow down. As well, two of us. Some may even stick, some may even be there wasting their time. They won't even flow until you tap it. They will start. They will flow. Two of us. But once you get granules and drop, boom, they do what? So they flow better than what? And the tablet preparation. I keep mentioning tablet. There's what is called. Let me not leave it. Let me leave it. I'll discuss it too. The granules need to flow. Hello? The granules need to flow down, flow on the hopper to get to where it will compress in the punch. And this thing works with time. So if it delays, you may end up seeing the dye may not contain anything. It may punch up and empty this thing. You may not even see any powder there to compress. Am I completing? That's why I say when I describe tableting machine, we'll talk about it. But just know, what I want you to know is that this thing, powder doesn't flow, but granules flow better than what? Powder. So to enhance flow of what? Powder. Now, granules have higher porosity. Granules have higher what? Porosity than what? Powder. They have higher porosity than what? Powder. And that's why they can be wetted what? Easily. You know, when you agglomerate it now, in different particles of powder, small particles of powder come together to form a granule. So maybe a granule, you will have something like this. Small particles of powder come together. So there's space, there's pores here, out together. When you say porosity, it means that they have what? They have what? Pores. Because if you see a granule particle, it's made up of what? Particles of powder that stick together. Am I communicating? So there are pores there. through which water can do what? Enter. And if water enter, that's why the particles can be wetted what? Easily. And that's why they can stick together easily when compared with what? Powder. So that's what we mean by what? Porosity. So granules have higher what? Porosity than what? Powder. Another reason why we formulate powder into granules is that granules improve compressibility of powder. I think I mentioned that here. Yes. If it's a granule form, you can actually do what? Compress, and they'll stay together as a compact mass. Then, next one is that there are some materials that are what? Hygroscopic. There are some materials that are what? Hygroscopic. If they are formulated as powder, over a long period of time, they will do what? Cake. They will do what? Cake. But for granules, it doesn't occur like that. Okay? For powder, they can cake because they will just come together and instead of what they will now form, when they now want to come together, they now form strong solid that you cannot even do what? Separate. They don't want to come together, but if they now want to come together, they form a strong solid and they can't do what? Separate. So it becomes a cake. So, and that's not what you want, okay? So that's why I said that materials that are highly hygroscopic may adhere and form a cake. I mentioned hygroscopic substance here. So if you miss your hygroscopy in your chemistry, you keep having issues here now. So hygroscopic substances, they do what? They absorb moisture, but they don't dissolve. They become what? Sticky. True of us, they can only become what? Sticky. So if a substance in powder form is inherently hygroscopic, so what will happen is that over a long time it will cake. And it's not good for a dosage form. In fact, once it's cake, it doesn't spoil, just throw it away, it's gone. It's gone. Don't even try to use it. Without the introduction of granules, so I believe now that if you are called to speak on what granules is for 5 minutes, you can't talk about it. True of us. So this is the introduction. Now let's look at classification. So you can define granules. You can say one or two things about granules. You can also tell us the reason why you granulate. True of us. I believe you can do that.
Yes, sir.
Because you are too much. Classification. Or you don't believe in yourself. Classification. So now let's look at. So we look at effervescent granules, coated granules, gastro-resistant granules. We also look at modified release what? Granules. Modified release what? Granules. Effervescent granules, coated granules, granules and what?
Modified release granules.
So let's look at effervescent granules. Effervescent granules. From the name, effervescent. In fact, effervescent formulation. We can also have effervescent powder anyway. Effervescent formulation. In general, what happens is that during the production, they will stop. During the production process, a chemical reaction will be initiated and stop on the way and package the what? The products. So that thing you buy, that effervescent tablet you buy or granules you buy, and once you put water, it will start doing. That is the completion of a reaction that was started in the production process. That's basically what happens in what? Effervescent. They will start the reaction. They will start the reaction and stop it on the way. Then they will package the products. So when you now get it, when you put it inside water, it will start. The reaction will complete, and it will form, and it will liberate carbon dioxide. Then to form a carbonated water. This carbon dioxide and coated water, they have effect on the products. Am I committing?
Yes, sir.
They help the products to achieve its what? Purpose. Now let's go down to effervescent granules. I just spoke of effervescent formation in general. Now effervescent granules, they are uncoated what? Granules. They are what? Uncoated what? Granules. And what do they contain? They contain acid substances. Here we see citric acid, you see tartaric acid. Citric acid is there, tartaric. Citric acid is there. Citric acid is there. Tartaric acid is there. Even we also have bicarbonate there. When we go into the formulation, we'll talk more on that. But just know that it contains acid substance and the carbonates or hydrogen carbonates. Am I speaking in French? This is chemistry now.
Yes, sir.
The same chemistry. The effervescent granules, here it has acid substance. I mentioned the acid substance there. We have citric acid there. We have tartaric acid there. This citric acid has one molecule of water of what? Crystallization. So it's crystallized. It has one molecule of water of what?
Crystallization.
So it's hydrated. Now, but this one is anhydrated. Let me not talk much on that, but just know that these two things, these acid substances and the carbonates or hydrogen carbonate present will react. These are the two that will react, that will initiate the neutralization reaction that will release the CO2. Is that CO2 release that you notice when you now put that thing and it will start? Well, you use it, right? You use these things, right?
Yes.
So that's what happens. So now, what are they intended to use? They are intended to be dissolved or dispersed in what? Water before what?
Administration.
Remember the terms. Dispersed or dissolved. If dispersed, what will be formed? Huh? If dissolved, what will be formed? Solution. Now, so they are intended to be dissolved or dispersed in water before what? Administration. You've been doing that, right?
Yes.
Good. Don't worry, we'll still go deep into the preparation. On getting there, we'll now talk more of this effervescent what? Granules. So we have our effervescent what? Granules. There, this one, you can see a combination of calcium ascorbate and the sodium ascorbate. Calcium ascorbate and sodium ascorbate. What is another name for vitamin C? Ascorbic acid. So ascorbate came from, is a sort of what? Ascorbic acid. So we have sodium ascorbate. We have calcium what? Ascorbate. So there is vitamin C there. Am I together?
Yes.
So ascorbate is a sort form of what? Ascorbic what? Acid. Are we together?
Yes.
That's why you see something like sodium ascorbate and calcium what? Ascorbate. So inside that thing, you have sodium carbonate, you have sodium, calcium, and vitamin C. So it comes as effervescent what? Granules. Good. So we look at. You say you have what by 8:30 today?
No.
Should we stop here?
Yes.
Okay, let's finish with the what? Classification, okay?
Yes, sir.
Okay? Tomorrow we'll now go into the what? Preparation. Okay? I think it makes sense. Let's finish with what? Classification. Good. Now, coated granules. Are we together? One house, please. Yes. Coated granules, they are usually what?
Multi-dose preparation.
Remember what we said about multi-dose, right? Yes. Good. So coated granules are multi-dose preparation that consists of what? Granule that is coated with what?
One or more layers of mixtures of various excipients.
Now, coated granule, just know that the granules have been processed and it's coated. Then, as it's flowing, the coating material is in liquid form. Is what used to what is spray on the what on the what the granules inside the what processing bed. Okay, so as it's flowing, the coating material in liquid form will now be what sprayed on it. So that's what we mean by that. They are usually what multi-dose. That means remember multi-dose. You take it again, you can still go back again and take another day, right?
Yes.
Multi-dose. And consist of granules coated with what? One or more layers of what? Mixtures of various excipients. Now, I think I have mentioned here that the substance that they use for the coating are usually what? Solution of what? Suspension, right?
Yeah.
Good. But after coating, they do what? Evaporation of the vehicle will do what? The vehicle of that suspension will do what? Evaporate, leaving the coating material on the what? Granules. Okay? So that's what actually happens in what? Coated what? Granules. Then let's look at gastro-resistant. With this, you don't even need to be told again what it's all about. Okay? Gastro what? Resistant. Does it protect the gastro mucosa lining? In your stomach now, the lumen now, where does ulcer occur in the stomach? The mucous membrane is what? Eroded, right? So now let's look at this gastro resistant. Let's see whether it actually processed, formulated to protect the what? GI, the stomach or not. Let's see. So they are delayed what? Release what? Granules. Remember we mentioned what? Modified release in our introduction of dosage form. Remember that? Okay? We have about 2 classes here. Some are here. Chris and Grafia. If you go and do it in their own class. Because you should ask him your lecturer, not your first friend. You are in class. Okay? It's not a good attitude to class. If you are confused, ask questions. That's why I'm in trouble. Ask questions if you are confused. Alright, so they are delayed, note this point, they are delayed release. Very important. If gastro-resistant granules are delayed release, true of course, they are delayed release what? Granules and are intended to resist the gastric what? Fluid and to release the active substance in the what? Intestinal. So what does it protect? Is it the stomach protect or the drug it protects? What does this gastro-resistant granules protect? Is it the stomach or the active ingredients? Some say stomach, some say active. It's for active ingredient that will degrade them by the gastric what? So it will protect the active ingredient until it gets to their site of action, mainly the what? Intestinal what? Tract. True of us. You know we have gastro-intestinal, gastro stomach, intestinal from the duodenum, right? Yeah. Down, right? Yes, so now, so it is intended to resist the gastric fluid and to release the active substance in the what? Intestinal fluid. So how do we achieve this? This is achieved by doing what? Covering the granules with what? Gastro-resistant material or by any other suitable means. So that's basically what happened. At this level, let's keep it at this level. I don't want to go deep into that, okay? At this level, this is what you need to know at this level. Because it's an entirely different area which will take us hours to go into. But just know that this is coated with gastro-resistant material to protect them, this active ingredient inside the granules against the effect of the gastric fluid. So they will now, so they can get to their site of action in the intestine. Okay, so that is the purpose Now,
Modified.
now the last but not the least is what?
Modified.
Modified what? Release granules. Modify release granules. When you hear the term modify release, what comes to your mind? Huh? What comes to your mind? You know, when a particular dosage form, be it tablet, be it granules, enters that's medicine now. Remember, inside the medicine you have the drug, remember? Yes. Another excipient and excipient. Now when the medicine itself now enters the stomach, now if it's tablet, it will do what? Disintegrate. But in summary, it will do what? The active ingredient inside that medicine will come out. Okay? Now it will be, we call it release. It will be released. Now when it is released for what? Absorption. When it is released, it will what? Absorb and get into the what? Systemic circulation and start distribution to different parts of the body where it perform its work. Now you can work. These are what you do in what is pharmaceutics. So these are what you do in pharmaceutics, trying to see how you can modify the pattern of release to achieve a particular what? Purpose. You can delay, the release can be delayed. It can be delayed. What it mean by delay is that you delay when it will release. Take some time, delay, release. Then it can be prolonged or sustained over a long period of what? Time. These are manipulations you do in pharmaceutics to get the best dosage form that will give you what you are looking for. How many of you, those that have been privileged to work in pharmacy, there are some diclofenac tablets, it's just ordinary diclofenac tablet, right? Yes. But there are some you see SR there. Yes. So, have you ever seen a tablet with SR? Yes. It's a modified release tablet. How together? There is this diclofenac tablet you will get. They will tell you take it on a normal 50 milligram morning and night, right? Yes. But the one that is modified, you'll be told to just take it once a day. It has been modified that if you take it in the morning, it will the diclofenac could be coming out consistently, prolonged over the 24 hours. It will be coming out like that. Okay? It will. So if you take just 100 milligram in the morning, you are sure that throughout the day it will release like that sequentially. You know, it has been modified. That's what we mean by what? Modified what? Release. So granules can also be in that what? Form. That's the point they are trying to make here. I think we'll stop here for now. We'll stop here for now. In our next class. In our next class, we'll start from what? Preparation of what? Granules. You are following this, hope you know. Yes. We go to what? Preparation in our next class. We go to what? Preparation of what? Granules. Any question? Ask. Any question?
I don't understand this last one now.
What is there you don't understand?
I just said the same.
Okay. Hello, please tell us. Stand up. So tell her what I said about.
He said that modify release granules that prepare the special procedure and they are delayed
Who else can help us with what I said here for the past 3 minutes? Hey, listen to her. You try. Sit down. Okay.
You said that modify release granules. Okay, that example, if you go to the pharmacy shop, that will see a piece of drug that they wrote SR. And that SR means modified release.
It's sustained release, but it's a modified release. You know what I said that? A modified. Some are prolonged, sustained, some are delayed, depending. Okay?
So he said sometimes he'll tell you take one in the morning. That when you take one in the morning, that it will last for 24 hours. That means it will be like going in small.
The what? What will go in small? Good, okay?
It will be going in small. So for that 24 hours that you took the drug, you are sure that the active ingredients
would have helped. But the one that is not modified, like I use the diclofenac tablet as an example. The one that is not modified, they will tell you take it 50 milligram in the morning, in the night. But the one that's modified, release 100 milligram you took in the morning, it's okay. You just be releasing small. Am I complicating? Does it make sense now? Any question? Any question? All right. In the absence of question, I think we have achieved something this morning, right?
Yes, sir.
All right. Tomorrow, remember our quiz tomorrow. Remember. Wait, some human being inside this hall say that it should be next week. And I put it to them that they are not serious. It's a sign of a serious human being. The morning. No, I can't use somebody's time for this. It's wrong. No. I want your time now. By 3 p.m. I want your time 3 p.m. Are we together? So, hello. 1 hour, please. 1 hour. We are live. Listen. Hello. Remember, we are live. Remember that the world are watching us. We are in serious business, so take it seriously. So know how you make noise. And Stephanie is making noise. Stephanie, I'll call your son and call everything about you now, so they know who I'm talking to. Okay. Now listen. So 3 p.m. our quiz. Our lecture continues in the morning as usual. But 3 p.m. is our quiz. So that's how we're doing it until exam day. So I will continuously assess you. That's been of continuous assessment, okay? So I will continuously do what? Assess you. Alright, see you tomorrow. God bless you.
God bless you too.